And action.
Hello, from Team Diaton. We're here at the Academy of Ophthalmology, and there's a question that we got from some of the customers, and we wanted to address it with you today. Once you get your box, what do you do with it? Let me save you some time and show you exactly what's going on once you receive the device, and some of the steps to take to make sure you get accurate readings each and every time. So just simply open the box, take out the device. You have quick start guide, which will allow you to show the correct and the wrong way of doing things, how to position properly the patient, how to work with the eyelid, and how to position the device. There's also another quick user's guide. It will explain to you all the beeping signals and or lettering on the display of the device. Very straightforward, step-by-step instructions. Yet again, with great images, which will elaborate and point out some of the things to do and not to do. Also, it comes with a battery. Simply unsnap the back panel. It's a non-proprietary 3-volt button battery. It's good for 3,000 uses. You press the center button and hold. With the plus side, just slide the battery in and release the finger. You should have 4 zeros in the display and the beeping signal. That means the device is ready to go. Just the cover cap. Snap it in. This is just the cap. Take it off, and this is the actual tip of the device. This is just a protective cover. Initially, what is suggested to do, on the carry case, there's a calibration tester. The device is pre-calibrated, but it's always good to check first time you use the device. Has 2 little indents. You could position and take a quick measurement. Okay, should be a plus or minus 1 of 20 on the display. The device is ready to work with. What we do suggest, you could also actually practice a few more measurements on the actual test eye or the calibration tester. I also strongly suggest to take few readings actually on your own finger. So a couple things to point out: how to hold the device. 3 fingers on one side, a thumb on the other. Do not hold it like a pen. It will limit your positioning and how to work with it. 3 fingers on one side and a thumb on the other. It has a little groove on the side. So with the device, it has a little floater, which is moving up and down. In order to get the floater in, you just simply tilt it back and it goes in and fixates. Turn the device on, position on your finger, and the beeping sound will actually help you find a vertical position. The correct position, the beeping will stop. Position, take a measurement. You'll get -1 on the display. Tilt it back for the second reading. Take a measurement. Device shows 2 on the display, at which point you press the center button. That will give you the average of the 2 readings. Okay? And I got a 4 on my finger. So now let's proceed to the eye. So there are no consumables or tips. You just use alcohol swab between the patients. Take the device, wipe off the tip of the device with the tip facing downwards. We don't want alcohol to go inside the body of the device. It's not going to do anything to the device. It just will take a little longer for the alcohol to evaporate. So simply swap it off. We do have a gentleman here that will help us to demonstrate. Thank you, Matt, for being with us. So patient positioning, it's a key point here because we want to position the patient correctly because we need to get that head as horizontal as possible. So here we're using a chair. The patient could be also in supine position as well. So the idea is to get the head as horizontal as possible. So Matt, if I may just sit a little closer to the edge of the chair. So we have some angle on a patient's back, then there is less angle on the patient's neck. Okay, so if Matt is sitting straight up, let's say like this, it's harder to get that head position in the correct order, especially with some patients that have some neck issues. So to solve that, sit them a little closer to the edge of the chair. The angle on the back will actually solve most of your neck problem patients. So tilt the head back as horizontal as possible. Okay, and do ask the patient to extend their finger forward. So what we're doing is just a pointer to center a patient's eye. Back to the device, 3 fingers on one side, a thumb on the other. Turn the device on, tilt it back, Use the edge of your palm for support on a patient's forehead. Gently pull on the eyelid to make sure the edge of the lid is above the edge of the limbus. You want 1 millimeter of sclera visible. Position the tip right over the tarsus, overlaying yet again the sclera. Take the first reading. Don't let the lid slide back, just hold it steady. Position 2, and one more time. 3. Device gives you a long beep. You have -3 on the display sequence of readings. It's not the actual IOP. You press the center button, you get the average of the readings, okay? And we're average 13. On the other eye, you're still on the same side of the patient. So if you're right-handed, you want to be on the left-hand side of the patient because you'd be able to rest the edge of your palm on a patient's forehead. So you just clear off the device, turn it back on. You're always starting off with 4 zeros. Back on the same side, get the head as horizontal as possible. I do suggest to use your hand just to push that chin up. I also use another hand just for the support for the patient. The thumb forward. So here I use the index finger to get, or the middle finger to get the eyelid upwards as the eye naturally opens, not to the side. On this side, I use the thumb, similarly getting the eye in the right position. One thing you want to avoid doing, don't let the lid slide onto the cornea. That's the biggest error. You'll get lower results because the device is calibrated for the lid and sclera. 2, 3. You press the button, you get the average of the readings. Okay, so that was a quick demonstration of the Diaton tonometer. This is just a protective cap. You put it back in, put it back in the case, and you're ready to store it in a safe way. Man, thank you so much. So yet again, this was a quick overview of the Diaton. Yet again, we appreciate your business. Thank you for ordering the Diatons, and we're looking forward to having more devices being used, because it's, as you've noticed, it's done outside of the visual field. It's great for pediatric population because the patient doesn't see anything coming to your eye. There's no need for anesthetic drops, okay? And no replacement tips. The device is pre-calibrated and it's ready to go. This box also has training video that comes with it, and a couple more extensive manuals. You could look through that. We also have many more videos on Diaton.com. So it's Diaton.com. And if you have any questions, please feel free to follow up with us. We'll be more than glad to solve any questions that you have. Yet again, Team Diaton from the Academy of Ophthalmology. Looking forward to working with you and your team, and hopefully we'll prevent blindness.